My name is Lastascia Coleman. I am a certified nurse midwife and clinical assistant professor in the Department of OB/GYN at the University of Iowa.
And my name is Kathryn Edel, and I'm a health educator with Johnson County Public Health. And this morning we're going to be talking about COVID-19 and the vaccine. And in regards to the mRNA COVID-19 vaccine, what is the recommendation for women who are pregnant?
Yes, and so most recently, some of our national organizations, so I have the statement here from the Society for Maternal Fetal Medicine, the Nurse Practitioners and Women's Health Society, the Association for Women's Health, obstetric and neonatal nurses, and the American College of Nurse Midwives have all put out a statement basically stating that the vaccine is thought to be safe for pregnant patients and those who are breastfeeding to take if they desire it, but they should also be supported if they decline to take it at this time.
Yeah, that's
Yep.
what my OB recently told me,
Mhm.
which makes a lot of sense because pregnant women, and correct me if I'm wrong, weren't included in the vaccine trials. So there's
That's
little
correct.
information.
Yep.
Yeah.
That is correct. So this type of vaccine is thought to be quite safe. So it's definitely reasonable and really, ideal if you do take it, just because the risks of getting this disease are going to pose a greater risk than a vaccine.
Right.
But if you're uncomfortable taking it during this like perinatal period, that's also something that should be supported.
Yeah.
Yeah.
Definitely. And you touched on this already, but can lactating women continue breastfeeding after receiving the COVID-19 vaccine?
Yes. Yep. The vaccine is appropriate for those who are lactating. And in addition, if you did have a COVID infection, we're still allowing and recommending, of course, breastfeeding for women and birthing people who've had that type of infection. It's thought that some of the antibodies and other immune properties that your body forms will pass through your breast milk to the baby. And so it's still appropriate to breastfeed if you did have an infection at some time during your lactation.
That's really good.
Yep.
And what are some things pregnant women should monitor after receiving the COVID-19 vaccine?
Really the same things you would monitor kind of no matter what your status is. And so, when you get a vaccine, in general, they recommend waiting in the area for at least 15 minutes to monitor yourself for symptoms of anaphylaxis. And this is a rare complication of receiving a vaccine, but if you're going to have that problem, it's usually immediately after receiving a vaccine. And so that's kind of the main thing. Most people are reporting things like just soreness in the arm where the vaccine is received. I've gotten my first dose and my arm was sore, but it wasn't really any different from getting like a flu shot or like a Tdap or something like that.
Yeah,
and so,
I recently had my Tdap
yeah,
vaccine, and
yeah,
my
it's going
arm
to
is
be about
still
the
pretty
same.
sore.
Yeah. So my arm was sore for about like 24 hours after I received it. And so that's kind of what I've been hearing from my colleagues who've also received the vaccine.
Right. And some of those, reactions to a vaccine, pregnant women aren't experiencing anything out of the ordinary.
No, nope.
Okay, great. So last question, what are other recommendations that you have for pregnant women or nursing women in regards to the COVID-19 vaccine, if anything?
Sure. One of the things I would recommend is if you are pregnant or lactating, that you consider joining one of the registries specifically for these populations who are doing like post kind of vaccine administration monitoring, just to see if there are any differences, especially since this population wasn't included in the studies. And so that's something I would encourage you to do. They're pretty easy. Yeah.
That's wonderful. Anything else that you would like to share?
Just making sure you're following those precautions that are recommended to avoid getting COVID-19 is really important. So wearing your mask, social distancing, not being within, close proximity of people who aren't in your household. It's such a contagious virus that,
Mhm.
I've heard many stories from my patients, and I've had a lot of patients who've had COVID-19 during their pregnancy. Probably at least every day when I'm in clinic, at least two of my patients have had the virus during their
Oh,
pregnancy.
wow.
And it's just, they'll tell me, they were just, with their family, and it just, everybody got it. And so
Mhm.
that's how it works. And that's where you're most likely going to get it, is kind of in places where you let your guard down a bit when you're
Yeah.
usually comfortable. So it's hard right now. It's very difficult, a difficult time to have a child with
Mhm.
kind of that normal social support being quite a bit different. When you could normally depend on having, family members in your community around to support you.
Mhm.
So that has been a big struggle for a lot of patients. And I would just encourage people to attend to their mental health, in addition to kind of the normal things, because it's a really challenging time. If you
Mhm.
need help, if you're feeling anxiety, if you need support, concerned about depression, those types of things, please reach out to your providers. And I'm sure you all at Johnson County have resources, to help
Mhm.
people as well if they're eligible for them. And so just keeping all those things in mind is really important.
Yeah, thank you for saying that.
Hmm.
And Lastasia, thank you so much for your time this morning.
You're
We
welcome.
greatly appreciate it here at the health department.
Yeah. Well, if you guys need anything else, please reach out and let us know. But we're happy to help here, if you need anything. Okay.
Thank you so much.
You're
Take care.
welcome.
Stay
Yep.
healthy.
Okay.